Let's start off by reviewing the heart and its coronary arteries. Here we have an image of the heart. The pulmonary artery leaves the heart and travels to the lung to pick up oxygenated blood. So when you breathe in oxygen and the oxygen travels to your lungs, the blood that travels through your lungs absorbs the oxygen to feed the rest of the body. Next, we have the aorta. The aorta is the main artery that leaves the heart with oxygenated blood and feeds all of the organs throughout our body. So the oxygenated blood that leaves your heart from the aorta goes to your hands, your feet, your brain, your kidneys, your liver, all of your external organs. Here we have a vena cava. The vena cava is one of the largest veins that feeds the heart after all of the oxygenated blood that came from the aorta gets dropped off and needs to return back to the heart to retrieve more oxygen from the lungs. Now let's focus on the coronary arteries of the heart. The coronary arteries in the heart, there's basically 4 coronary arteries. You can look at the left anterior descending coronary artery, the circumflex coronary artery, which are both met by the left main coronary artery. Then we have the right coronary artery. So all in all, we have 4 coronary artery branches. Arteries hold oxygenated blood while veins hold deoxygenated blood. Here we have a snippet of the coronary artery. Within the coronary artery, we have a blood supply. This blood supply is actually oxygenated. It's traveling along the coronary artery, and the smooth muscle, which consists of the coronary artery endothelium, is pumping the blood throughout the heart. Eventually, the blood comes across an atherosclerotic lesion, also known as a plaque, made of lipids, calcium, and a bunch of debris that has built up over the years. If this blockage remains in the coronary artery, the oxygenated blood is unable to reach a certain area in the heart. The very hungry cardiac muscle in the heart is desiring and needing oxygen, but because the blood supply is lacking or low in that certain region of the heart, the hungry cardiac muscle is unable to retrieve the amount of oxygen it needs, thus causing angina or chest pain.